Hi all, this is Professor Dragan Ilic from the School of Public Health and Preventive Medicine. Welcome to this presentation in which we're going to just go through the critical appraisal template for those of you who are wanting to do your assignment on a study that is either a randomised controlled trial or a cohort study. So here we have the critical appraisal template, which is very similar to that of the one that we used in semester one. The main difference is this first part around the methodology. So what we'll do is just quickly run through that, and in doing so, I'll hopefully give you a few tips in terms of how to tackle it. So the first questions are really, like I said, relating to the methodological aspects. Point one, were there clearly defined groups of patients similar in all ways apart from the exposure of interest? So with a randomised control trial, hopefully through randomisation, we can get an even distribution of participants and an even distribution of comorbidities and hopefully reducing the effects of any confounding factors. In a cohort study, because people are being exposed rather than randomised to a particular factor or exposure or intervention, there's a possibility for the groups to be misaligned, I guess, in terms of numbers and other confounding factors. So here we're basically looking at how the groups were allocated, and so looking at biases such as selection bias. If the groups are uneven, that's fine. What we tend to do and tend to find with cohort studies is that we can statistically adjust for any differences between the groups. So if that was the case, please highlight that aspect. The second question, were the circumstances and methods for detecting the outcome similar for the exposed and control groups? So this is looking at, as is intimated in the question, detection bias. So how are we assessing the outcomes? Were they performed in the same way for those that were in the exposed as opposed to the comparison groups? And really looking at the methods behind it. So we're hopefully wanting to see that there's no difference in terms of how the outcomes were assessed between the two groups. The third question relates to attrition bias. So was the follow-up of participants sufficiently complete? So again, were there any dropouts? And if so, were they accounted for? So once again, you can look at your baseline characteristics and compare that table to your results. And if any participants have dropped out, hopefully the study authors have identified reasons for that. So the second part of the critical appraisal relates to the results. So very much like the first critical appraisal task, we've got the same question. So what is the relative risk or risk ratio? How strong was the association? And how precise was the estimate of risk? Now, with your cohort studies, you may sometimes not have the relative risk reported. It may be reported as an odds ratio or even as a hazard ratio. What I'd suggest that you do is quote whatever statistic that is provided in the paper, interpret it, and then for the purposes of the critical appraisal task, calculate your own relative risk. Some of you may encounter papers that have person years. So in that case, please use the same denominator for both your exposed and comparison groups. So it may be 5 out of every 10,000 person years. So when you're reporting your results, report it according to the person years. How strong is the association between exposure and outcome? So again, here what we want you to do is to be able to, I guess, describe the relative risk. So exposure to this particular risk factor increase the risk of mortality by 20% or 50% or whatever it may be. With the precision, I want you to comment on the confidence intervals. So how wide they are, how narrow they are, what they mean in terms of sample size, what you can tell from them in terms of statistical significance as well. If you don't have relative risk or any dichotomous data for your primary outcome, I'd suggest that you use the secondary outcome to demonstrate your understanding of relative risk and being able to interpret it. If your data is continuous, please also just descriptively report that. So report any differences between the means. So if you're looking at a particular exposure and the outcome is pain, obviously you wouldn't be able to dichotomize that fairly easily. So I'd encourage you to provide a narrative. So, pain was significantly increased in the group exposed to whatever the risk factor was. And then, if possible, try and choose another secondary outcome to calculate your relative risk and other calculations. So question or part 3 is the new aspect that we've included for studies around harm. So do the results satisfy some diagnostic tests for causation? And what we want you to do is, again, provide a paragraph response for each of these points, if possible. So is it clear that the exposure preceded the onset of the outcome? So did the outcome occur after people had been exposed to whatever the factor may have been? So what we're looking here is really trying to identify that there is an association between exposure and then prospectively in terms of outcome. Is there a dose response gradient? So you'll be able to determine that for any interventions around drugs, I guess. So 5 milligrams, 10 milligrams, 15, etc. And whether there's increasing harm as you increase the dosages. For some of the studies that may not be possible. So if that's the case, just please highlight why it is not possible to answer the question around dose or dosage and the outcome of interest. Question 3, was there any evidence from a de-challenge re-challenge strategy? So the de-challenge re-challenge is basically saying if we have the exposure, do we have the outcome? But more importantly, if we remove the exposure, do we also remove the outcome? Now, again, this is typically, well, you typically find it in studies around drugs. So we give a person drug A, we identify that they've got GI side effects. We remove them from drug A, and the side effects relating to the gastrointestinal tract disappear. So that would be an example of a de-challenge re-challenge study. Again, a lot of your scenarios may not lend itself to a de-challenge re-challenge study. If that's the case, again, just highlight what is de-challenge re-challenge and why it is not possible in your particular scenario. So part 4 relates to basically pulling your appraisal of methodology and the results together and relating it back to your scenario. So again, looking at your case scenario and how similar or different your patient is to the patients reported in the study. Remember, your patient doesn't have to be perfectly matched to your study. So it may be a case where you have a great study, but it does not relate to your patient, which is totally fine. Was the duration of follow-up adequate? Again, we're only looking at this being applicable to RCTs and cohort studies because they're prospective. If the participants were exposed to the risk factor for 5 years, was that an adequate duration to see the outcome of interest, as opposed to if the exposure was only for a few weeks? What was the magnitude or seriousness of the risk? In this case, what we're looking for you to describe is the number needed to harm. Are there any benefits that offset the risks of exposure, or should an attempt be made to stop the exposure in your patient? So again, this is pulling all the information together and identifying, well, what is the magnitude of the risk, given the quality of the study, what should you do or what should you recommend for your particular patient scenario. So here we have the, I guess, essentials for the critical appraisal task. So what we want you to do is complete the various steps, complete a vignette, define the information gap, identify the PICO elements, construct an answerable question using PICO, at least highlight a couple of databases that you would use. You only have to search Medline, but please highlight what other databases may be of use. And I guess a tip, PubMed and Ovid Medline are the same database, that is Medline, so please don't list them as two separate databases. Once you've conducted your search, a screenshot is fine for that. Identify the studies that you've come up with in your search. A one-liner in terms of why you have chosen to exclude the studies. And then about a paragraph or so highlighting why you've chosen your particular study, and hopefully you can relate it back to your clinical scenario as well as the evidence pyramid. In terms of the article itself, please also provide a PDF copy of the article that you've appraised. So part 2, there we have the due date. The word limit is 2,000 words. Please submit it online through the Year 3B Moodle site. In terms of the document, try and put your assignment on the one Word document. So using the first half and then the template for the critical appraisal in the second half of your Word document, and then also upload a PDF copy of your article. Feel free to also upload any supplementary materials, so there may be protocols or any other master copies, I guess, of the study where relevant. You'll receive a Turnitin score when you submit. Again, feel free to submit as many times as possible. We know that your Turnitin score will be slightly elevated. That's because everyone's using the same template, so don't be concerned. If there are any issues with your Turnitin score, we will contact you directly. If your article is an RCT cohort study, please submit it via that link. Conversely, if your article is a case control study, please submit via the case control link. Thank you for your time. Hopefully you found that somewhat useful, and all the best in your critical appraisal tasks.